Welcome back to CP24. From Botox to photofacials, there are all kinds of cosmetic treatments out there that may enhance or may adversely affect your appearance. How do you select the right treatment clinic for you? We've got the man here to provide the answers. Joining us right now, Dr. Stephen Mulholland with SpaMedica. Good to see you. Thank you so much. Tis the season. People are thinking about giving gifts to themselves, and it might be the gift of a sort of an instant look of rejuvenation. But there are some cautionary notes that we want to first put up. How do you find the right clinic that you can trust and you can trust the doctor as well?
It's a great question, and to look good, feel good is great, but you don't want to get into complications getting there. And so you want to make sure in this day of med spas, there's actually a medical part, there's a doctor involved. Usually not a nominal doctor, a guy who shows up once a month, but a guy who's involved in it, who's invested his reputation and time in it. And then you want to find out who's doing the treatment. Is it the doctor doing the treatment, which sometimes happen, or is it a technician? And if it's a technician, is it a registered nurse or someone less trained and less medical than a registered nurse? Because most laser treatments, even Botox and fillers, are not often done by a doctor.
And are you in a position to say, I want to see your certificates, I want to see certification?
That's important. So due diligence, buyer beware. How long have they been in business? Is there any complaints to the College of Physicians and Surgeons about them? Have there been any medical legal actions? Ask those questions. Check with the Better Business Bureau. And mostly, do you have friends, family, or coworkers that have been to that facility, had good results? Because there's nothing like proof in the pudding. And if your friend looks good or your sister looks good, you'll probably look good.
I want to talk about some of the treatments that are available, and they sound great. It sounds like a lunchtime kind of thing. You don't have to go under the surgeon's knife. But again, one has to be cautious. One has to be well-informed. One has to be a smart consumer. Botox, everyone talks about it, and it seems to be now as common as going to the dentist to have your teeth cleaned, to have an injection of Botox. What can go wrong? What should you be asking?
There is a real wide array of things for your face and your body you can do without surgery. Everything comes with risks, and the risks are usually very acceptable, but they're never zero. So be very concerned with a facility that doesn't even talk to you about risks, doesn't give you a consent. You need to understand the risks and the benefits. Having said that, ask your treatment facility how long you've been doing it. How were you trained? What kind of complications have you had? And how do you look after them? In the final analysis, there are so many things you can do with needles and lasers and light to your body and your face that if you find the right facility and you feel comfortable about them with good word-of-mouth referral, you should be looking good for the holiday season.
It is a huge financial investment. A lot of people feel it is worth it to feel better, look good, not have to go through surgery. But are there ways can you shop around to get the best deal? Will one's company's insurance company take care of any of these treatments depending on what they're for and who they're for?
Well, that's a good point. At SpaMedica, we always give them a receipt because many companies now give them private insurance options, and they can use some towards cosmetic dentistry and cosmetic medicine. So we give them an invoice and say, check with your private insurance carrier and you may get some of this covered. There are different price points, clearly, and when it comes to your face or your body, usually discounting is probably not the way to go. The range in price at most physician-run facilities is not that wide, and often you get what you pay for.
How do you stop people from going too far? We all want to look younger, we all want to look better, and if it's as simple as an injection of a needle and some time spent under the photofacial lights, whatever it is, it's pretty hard. You kind of do a little and then you want to do more, and you almost have to serve as a physician, a doctor, but as a psychiatrist as well to help people emotionally.
You're exactly right. With a nip and tuck and 90210 and the Swan, people often substitute psychological issues with cosmetic medicine. I'm not feeling good. Oh, maybe Botox will help. Usually we take a good medical and thorough medical history. If they're on a lot of antidepressants, if they're out of a job, if they've lost a loved one, if there's bereavement issues, cosmetic medicine is not what they need. They need a psychologist. The vast majority of people are pretty stable. They're pretty healthy, and they just want a little pick-me-up. And usually in the med spa, we're not talking a knife, so the risks and consequences are not dire. But cosmetic junkies, the cosmetic cosmoholics, I call them, you have to be careful. They seek outcomes to replace psychological well-being.
This is a big, booming business, and particularly here in this country. Are we considered in Canada leading edge when it comes to this kind of stuff?
The consumers and the patients in the Toronto area are certainly very lucky. There's a lot of good trained plastic surgeons and physicians, and we have a more reasonable health protection branch than the FDA. So we get access to a lot more options that we can pass on to patients than our American counterparts might.
What are we looking forward to? There's so much out there right now, but what's next, do you think, on the horizon?
Well, what's coming in the new year is 2 or 3 new devices that work on, let's say, rejuvenating our chest and our hands, because we do really well with the face. Assaulting the DNA, which is the very fabric of why we age, is really on the 3-year vision or 5-year vision. Can we stop with topicals and non-invasive approaches how our cells actually, how we age? And if we can do that through gene research and safe topical medicinals, then all the restorative surgery I do won't be necessary and I'll be out of a job. But we'll all look very young.
That's right, exactly. We'll meet in the unemployment line.
No, that's right.
I want to see some of the before and afters because I think people find this quite fascinating. What was the situation here?
Well, here we have a young lady who was suffering from a skin condition called rosacea, as you can see in her pre. She's got loss of her fat volume and her face is drooping and her brows are drooping.
She's not very old.
No, she's not. She's just 40. And she went through what's called our PAN-G, which includes photofacials, some volume restoration, Restylane, things like that, and some deep treatment to her muscles. And she looks easily about 10 years younger. We've reversed her sun damage and her aging and her environmental changes, and that can be done relatively risk-free in about 10 weeks.
Cellulite is something that some men have, lots of women have. I mean, it's a common fact of life, and there's a non-invasive way of dealing with it.
Yeah, this is our Lipolite program, and this lady before didn't like her hips, and she had what I call the banana roll, those excess folds under her bum, and she went through our Lipolite program, and again, without surgery, without liposuction, over 8 weeks, we were able to change 8 centimeters, take her down 2 dress sizes, and smoothen out her cellulite. And you know, these things weren't available without surgery just 5 years ago.
Everything you talk about, I would think, has to go hand in hand with a good lifestyle. Exercise, the way you eat, the stress and how you deal with it, drinking, reducing it, not smoking. I mean, do you offer that kind of advice, and would a good clinic make sure that that kind of lifestyle info goes hand in hand with the technical stuff?
Absolutely, and not to address, do you smoke, do you go out, do you not protect your skin, are you obese, do you not exercise? That's all part of a healthy, balanced approach to your body. So we do look at nutritional status. We offer oral rejuvenation programs, supplementation over missing elements you might not have, together with the topical and the therapeutic. So nutrition, health, no smoking, sun protection, those are the top 4 things you can do, even if you never go to a medical spa.
Shop around, ask the right questions, be informed, and when in doubt, make sure that you check it out.
Absolutely.
All right, Stephen, thank you very much. Appreciate it.
Thank you very much.